We're here with Dr. Olivier Cattin, who's working as a chief medical officer in an international clinic in Myanmar. So welcome, Olivier.
Okay.
At the end of February 2003, he was working as a doctor in the French hospital of Hanoi in Vietnam, and he was faced with the case of Chen, a businessman who was affected by a severe respiratory disease, which would later be known as SARS. 20 years after the death of Carlo Urbani, a WHO doctor who died on March 29, 2003, I'd like to go through again those tragic times together with Olivier. What symptoms did Mr. Chen have when he arrived to the hospital? And what type of disease did you suspect he could have contracted?
So Johnny Chen just arrived from Hong Kong on the Wednesday evening, and I saw him on the Thursday morning, and he was presenting a severe pneumonia. And the first biology result and chest X-ray was showing mostly atypical pneumonia. So we're thinking at the beginning like Mycoplasma legionella, and we start to run a lot of tests that we could in Hanoi, like in PCR for flu, and legionella test was not available. At this time, I asked my chest physician to come to help me and confirm it was an atypical pneumonia with a very strange X-ray with patchy images, both field, and it looks like it was snowing in the lung fields. So in my experience and the chest physician experience, we have never seen such a case before. And that's why we start to ask some help from WHO and from Pasteur Institute in Hanoi.
When and why did you reach out to Carlo Urbani? And what made him realize that the disease you were facing was extremely dangerous?
We were aware in Hanoi that there was a strange outbreak in Guangzhou. Some of my friends from Airbus industry were supposed to travel to Guangzhou 2-3 weeks before. And they told me, oh, we cannot go to China. There's an outbreak. We have to stay in Hanoi. So when I saw the patient coming, I said, oh, let's see the webpage from WHO. And I saw that there was an outbreak in Guangzhou, 300 cases, 5 days. So not on Thursday, but Friday, we called WHO and tried to reach Dr. Fabio. We knew Dr. Carlos. Dr. Carlos Urbani, we knew him from previously. We have met him for work at WHO. We met him socially. We were going also to the church together, and we met also for some retreats in the mountains. So I knew that Dr. Carlos might give us some information on this outbreak in China and might give us some guidance how to manage this patient. So the patient, when we called WHO, Dr. Carlos was traveling, was not available. It was second day after admission. And the patient was not critical yet. It was still a severe pneumonia. And the patient started to decompensate 4 days after admission on Sunday. And we have to intubate the patient and put the patient under ventilator. So on the following Monday, we keep calling WHO, trying to reach Dr. Fabio from technical support to say, what's going on? We need to inform. At the same time, we inform the US Embassy the patient was a US citizen. And we try to retrieve the first result from Pasteur Institute.
Given the seriousness of the situation, you decided to warn the WHO and the Vietnamese government. How did you manage to convince them to put in place extreme measures to contain the infection?
So the answer is simple. We are facing two problems. One, the first problem was this Johnny Chen, the initial patient, was in critical phase, intubated, ventilated, and it was from Pasteur Institute influenza B positive. So we're facing major critical flu patient. The second problem that our staff start to be sick. So since Monday, we have 2 nurses, and Wednesday, 4 nurses will start to be sick. So when Dr. Carlo came first on probably 4 days or 5 days after the patient admission, what strikes him was not only the patient condition, which was critical, but the nurses start to be sick very quickly. So Dr. Carlo Urbani has calculated in epidemiology we'll call the attack rate, so the number of secondary cases after an index case, and these cases were much higher than you will expect for flu. So Dr. Carlo told me, well, it's not a normal flu we're dealing, it's something else. At this time, Dr. Carlo absolutely start informing the regional flu center in Japan. And for us, we start to take strict measures in hospital, like patient isolation. The index patient has been medevac to Hong Kong, back to Hong Kong on Wednesday, so almost 1 week after his admission, and he passed away 2 weeks after in Hong Kong. And at the same time, when we're moving the patient away from Hanoi, my nurses, the medical staff from the French hospital, were getting sick one after the other one. That's where Dr. Carlos focused. I say, okay, this is not normal. Something unusual is ongoing. The clinical features, the X-ray, and the speed of this outbreak is not flu. So it's him who just have the hint. If we're not dealing flu, we're dealing something with something different.
Carlo Urbani died in Bangkok on March 29, 2003, after contracting SARS. How did you find out of his passing, and what memory do you have of him now, 20 years later?
When Dr. Carlo Urbani passed away, I was in UK. I left the French hospital as I resigned 1 month before the outbreak, my position. So I have to join a new job in Jakarta, and I was sent for training in UK. And my family informed me that Dr. Carlo passed away. Well, it was a big shock because I called him to help us. And he did the fable. He saved Hanoi, and he helped the world to discover the SARS and to fight the outbreak. So it was a big shock because I felt it was unfair because myself and my colleagues we did not have any of the disease. He had the virus, he passed away. So it was, how do you say, a long mourning for myself and the survivors of the SARS in Hanoi, the departure of Dr. Carlo. Big loss for the medical community. And for us, we and the French hospital, the medical community, we owe him a lot. I think without him, well, we will have never taken the measures in the French hospital, or too late. The virus will have spread outside the hospital, and much more people will have died in Hanoi. And also the global response from WHO will have been delayed from a couple of weeks, and it will have been a disaster. So his incredible action, his hint that it was not flu, and his forceful action. So we talked to the Vietnamese authorities. It was when the Chinese patient was moved back to, American Chinese patient was moved back to Hanoi. At this time, we start to alert the Vietnamese authorities. We were pretty reluctant to do anything. They first sent an epidemiologist team, not just to do a survey, and the Vietnamese director don't play the importance of the outbreak, and so it was blocked. So last conversation I had with Dr. Carlo Urbani when I left the hospital, he called me just to push the Vietnamese director to talk to the Vietnamese Ministry of Health. Please consider this outbreak as a major health problem from Hanoi. So I had a hard talk before we shut down the hospital. I have to leave the hospital because I was not employed anymore. But my last conversation with Vietnam French Hospital with the medical director was a hard talk. to say now Dr. WHO is instructing that the hospital is closed and we should take action. Luckily, he listened to me and he's authorized some experts to come, and later he authorized a French SAMU team to come to help my colleagues. So, because many people went sick, up to 24, and many were under ventilators. At this time, we knew since the coronavirus that what is critical is the numbers of ventilators. And in Hanoi, we didn't have enough ventilators and we didn't have enough people trained to ventilate people. So Dr. Carlo, when he fell sick, knew that if he was staying in Hanoi, he will die. So moved to Bangkok, and he was exhausted. He died in ICU from cardiac failure after a long time under ventilator. It's very sad, extremely painful for all the Vietnamese medical team, including myself.
Ringrazio tantissimo Thank you very much, Olivier Cattin, for your time, for sharing with us this experience. And thank you also to our interpreter, Matilde Borella, without whom this interview would have not been possible. So thank you very much and see you soon.
It's my real pleasure. Thank you. Thank you for the memory of Carlo.